So again, thanks so much for having me. I talk about nutrition and migraine disease with my patients on a regular basis. And what I found is everyone has questions about specific ingredients, specific diets, what they really need to hone in on in order to be successful with their migraine disease management. And I wanted to take this time to go over the foundations for nutrition because I feel as though we need to understand where we are and how the brain and the gut works in order for us to make this nutrition make sense for us. And so my objectives for this talk, just put my screen lower. Good. I'm going to review why migraine disease and nerve cell pathophysiology is important to understand the foundation for nutrition, as I just said. Going to introduce the brain-gut connection and its relation to migraine disease, discuss several neuroproteins with roles in the brain and the gut, elucidate the migraine disease trigger conundrum, and present several special diets and evidence behind their use. So this is the migraine disease pathophysiology picture. If I show this picture to anyone in the street, they will look at it and say it's just a picture. But actually, it's much more than that. This is migraine disease. This is how it works. And researchers have really honed in on this in order to come up with novel treatments that everyone is seeing right now. So I just want to point out a couple of things. So if you can see my mouse, this is someone who's you're looking at someone from the side. And this is the front and this is the back. And you see here different yellow lines that are projecting and green lines. And that represents the nerve projections that are coming out of the brain. So you see here the star of the show we call is a trigeminal ganglion. And within that ganglion, a ganglion is a bundle of nerves, and you have those nerves projecting out and going to different areas, okay? So the first connection that I wanna make sure you see is that you have the trigeminal ganglion going out here. This is the outer protective surface of the brain. It's called the dura. And through the dura, there are blood vessels that come through. And you can see here that the trigeminal ganglion is touching on those blood vessels, okay? So it can influence those blood vessels in that way. And then you see projections that are going back and down. And this area is the brainstem area, and the brainstem is directly connected to the spine. And within that, there's something called the trigeminal cervical complex. And that's basically cervical is the neck portion of the spine. And that really explains a lot of the times why people can have pain in the brain that refers to the neck. There are many different reasons, but if it's just you, if you have migraine disease without issues of the spine, this is a reason why that can happen. And you can see the yellow lines going up and then touching upon different areas of the brain, like the thalamus, the hypothalamus, that connects to the pituitary, which we'll talk about later in the talk. But you can see all of these connections. And within those connections, there are certain substances that are secreted and released. And those substances are the communications that occur that allow the brain signaling to propagate. So we'll go on. Now, I want to hone in on a specific area of that pathophysiology and the anatomy. And this is a neuron. And a neuron is a working cell of the brain. And how does it work? So we have here the cell body of the neuron, which contains the nucleus. I consider the nucleus like the brain of a cell. It's the powerhouse where a lot of the making and the energizing goes into in order for it to continue its communication. So whatever is made in the nucleus, it travels down this long pathway along the nerve, and then it reaches the axon terminal, which is the ending of the nerve. Each of these nerve endings attach to other nerves where? Over here at the cell body. And that's how they communicate with each other. You can see these kind of little coverings along the neck of the nerve. And those coverings are what we call myelin sheets. And what they do is they basically insulate that area. Think of wearing a turtleneck. It's kind of like a turtleneck around your neck. And it's letting the electrical signals of the nerve go through quickly. Without that sheath there, it's going to go through slowly. Okay. And at the end here, the substances are secreted and released, and they go latch on to another nerve at the cell body, at what we call the dendrites. And along those little dendrites, there are things called receptors to receive. The receptors latch on to the substances that are secreted. You heard about CGRP. CGRP is one of them. So there's a CGRP receptor there. And then that's how it can, again, do its job and continue the signaling. So neurons engage in cell-to-cell communication from the brain to the rest of the body and vice versa. And what kind of signaling it is? It's electrical signaling. And how do they do this? They release neurotransmitters and substances through the nerve terminals. And what does this do? This contributes to nervous system functioning. So we talk about contributing to plasticity, which is molding and changing of nerve signals in order to create a final product, which could be processing, emotions, autonomic function, which are nervous system functions that we don't have to think about, like breathing, okay? Like movement of the gut. And then we have sensory signaling, like the pain that we experience, feeling cold, hot touch, and also movement, of the arms, of the legs, of the face. So what is the brain-gut connection? I really think this is a very important part of migraine and nutrition, because the brain communicates with the gut communicates with the brain. They have many substances that are in common, and it's really important to touch upon this and understand it, because it is the basis for nutrition. So the gut has something called the enteric nervous system, right? So we know the nervous system as a whole. There's the central nervous system, which is the brain and the spinal cord. There's a peripheral nervous system, which are nerves that are not in the brain and spinal cord. They come out to the arms and the legs. And then there's the autonomic nervous system, which are the automatic systems that occur, like breathing and temperature regulation. And then there's something called the enteric nervous system, which a lot of people don't really talk about, but it's there. And these are millions of nerve cells that are lining the GI tract, okay? And they're responsible for the gut that moves to move the food along after you eat. It's secreting substances to break down food, and also it absorbs the nutrients that come from the food that you eat. What does the brain have? Obviously, we know brain nerves throughout, but I pointed out the hypothalamus and the pituitary in the picture. So we have something called the hypothalamic pituitary adrenal axis, which is basically a connection between three areas that mediate stress responses. And substances and hormones are made through this area, and they're released into the body, and they really impact the gut. And then we have the GI tract, and within the GI tract, they receive these signals. These signals communicate with substances in the gut, and they affect the central nervous system via cognition, behavior, pain signaling, and initiation. And we also see this brain-gut connection when it comes to mood symptoms like anxiety and depression. So more specifically, I wanted to have a schematic here that explains this a little bit better. So we have the brain on the left side and the gut on the right. And in the middle, you have what they share in common and what interacts with each other to make this communication right. So we have an indirect communication that occurs between the two, and that's through the autonomic nervous system. And there are microbiota that live in the gut that I'll talk about that secrete substances that do this. And then there are inflammatory molecules, again, that are throughout the brain, throughout the body, throughout the gut, that really impact both, the connection with both. And then hormones, obviously, communicate with this as well. What is a direct communication? The vagus nerve. So we know about the vagus nerve. It starts in the brainstem, and then it goes from the brainstem and travels all the way down. And it impacts various functions. We call it the rest and digest nerve. So there's fight or flight and rest and digest. After you eat, that vagus nerve is pumping and making sure that your body is digesting. If you're having an anxiety attack or you feel really stressed and you you can access the vagal nerve in the neck, and sometimes they talk about massaging it, and that can really take in, put forth the auto regulation to relax. So the vagus nerve is important in that function. And then we have other substances that are involved in this whole circuit, which are serotonin, dopamine, gamma aminobutyric acid, and CGRP, of course, there it goes again. All right. So we have there in the middle all of these that they share in common. Okay, so what about inflammation, migraine disease, and the gut microbiome? So what are the microbiota? I alluded to this. Microbiota are little organisms, bacteria that are in the gut that are making substances and working like 24/7 in order to keep balance of the gut, okay? They derive neurotransmitters, different proteins, and inflammatory molecules and hormones, and they release these proteins to keep that balance, okay? They are stimulated by the vagus nerve, and they also stimulate the vagus nerve to keep this persistent rest and digest state in the gut. They are also influenced by what happens elsewhere in the body. So if you are going through stress for any particular issue, you might release cortisol, and cortisol goes to the microbiota, and it might change the profile of the microbiota to change then the way the intestines work, and the intestines become permeable. And what happens? That may create an imbalance in the microbiota. They're also influenced by different nutritional sources. So there are short chain fatty acids that are made by the microbiota in the colon, and they also maintain gut integrity. They're known to be neuroprotective based on research, and they also can suppress central nervous system inflammation. So really the microbiota are very important, and you can really start to see why individuals talk about probiotics and how it's important to maintain your gut health and gut balance, because any imbalance here can cause something that we call gut dysbiosis, which is the gut imbalance that I keep referring to, and that really can throw things off and can impact individuals with migraine disease based off of the physiology that I spoke about. So I want to go through several neuroproteins that are circulating throughout the body that impact the brain and the gut that are involved in migraine pathophysiology. So glutamate. Glutamate is a powerhouse of our bodies. It's a powerhouse of the brain because it's the main excitatory neurotransmitter of the nervous system. When we talk about migraine pathophysiology and how it works in terms of it's a disease of hyperexcitability, I'm talking about glutamate. Glutamate is a star of that. So what happens is at those nerve terminals that I showed you, glutamate is released. And we see that it's involved in different aspects of migraine pathophysiology. And what you see here, you hear us talk about cortical spreading depression a lot. And what that is, it's basically this wave of hyperexcitability and inhibition of nerves. They're getting excited and then they're like dropping off. And what happens is glutamate is being released from the nerve terminals and communicating with each nerve. And we see this cortical spreading depression really prevalent in a phenomenon called aura. Individuals can have migraine with aura, migraine without aura. Aura is a transient neurologic symptom that is reversible, and it can happen before, during, or after the migraine pain phase of the attack. And it can be seeing something sparkly, like it can be visual, moving across your vision. It can be numbness, tingling in the body. It can be weakness on one side of the body. It can be trouble talking. Depending on where the depression is happening, the aura can occur. Then there's something called central sensitization. And remember the schematic that I showed you of the trigeminal ganglion, the trigeminal cervical complex? Those signals are occurring, and because the excitation is so prominent, it causes this deep central excitation of deep structures of the brain, and that's the central part of the brain, and everything is becoming highly sensitized. And that is one of the explanations why individuals with migraine may feel pain in certain areas of their body when they're not in pain. For example, scalp tenderness. When it's not normal for me to touch someone's scalp and they feel very tender there. But in someone with migraine disease, they can have something called allodynia, where they feel highly sensitive to a normal touch. I'm not pricking them, I'm just touching, and that's painful. And that's allodynia. And the process behind that is the central sensitization, glutamate. And then there's a trigeminal vascular system. I showed you that. When you looked at the big picture, you saw the trigeminal nerves that were projecting to the blood vessels, the vascular system, the veins and the arteries. That's the trigeminal vascular system. And glutamate, you can see how it makes sense that glutamate is being released there and impacting them as well. So we also have glutamate in the enteric nervous system. And you have this excitation. With this excitation, there are other substances being released. So I'm talking about many substances being released. And a lot of the time there's inflammation, and 100% of the time there's inflammation, okay? And the gut can really have impact from that. It can have inflammatory products being released, and that creates this oxidative stress. And that process really could also explain the involvement of other various GI disorders that we see. We can have irritable bowel syndrome. We can have irritable bowel disease, which is Crohn's and irritable bowel syndrome. And then we can have GI reflux from that. So that's glutamate, ladies and gentlemen. And then we have neuropeptide Y. This is important in cerebral blood flow circulation. We see it being secreted and in high levels during the migraine pain phase. And it's also detected along the gut-brain axis. It's important for gut function, immunologic function, and the inflammatory state. It propagates pain signals, and it also impacts behavior and cognition. Hello, hello. What do we see here again? Calcitonin gene-related peptide, of course. You've heard a whole lecture about this. You know it's involved in the pain signaling pathways of migraine. There are CGRP receptors in the gut. It works to inhibit gastric acid secretions, and it's thought to influence microbiota levels in a negative way. So you can see again here a reason why probiotics could be important, and why many nutritionists who take care of individuals with migraine recommend probiotics if there's some sort of gut dysbiosis or imbalance. The last of them here is cholecystokinin, CCK. It's made by the gut and different pain signaling systems of the brain. It's also present in the trigeminal ganglion, which I showed you. It's released there when it's stimulated. And it's also involved in gastric emptying and secretion. It's responsible for that I'm full and satisfied feeling. And during migraine attacks, research shows that its levels do rise. And then there's serotonin. Serotonin is a powerhouse of a neuroprotein. Its precursor is tryptophan. Tryptophan is found in small portions in the gut, and as gut metabolites, and they're produced by the microbiota in the gut as byproducts. With serotonin, we know that it's a target for various migraine-specific medications. It's involved in migraine disease. It's involved in depression, anxiety. That's why there's a crisscross between serotonin in terms of mood disorders and serotonin with migraine disease. And we see that targeting serotonin is effective in migraine prevention and acute therapy. We need to talk about triggers, because there's some issues I have with trigger, and a lot of people have with trigger. So what's the Webster's dictionary definition of trigger? To initiate, actuate, or set off, to release or activate, to cause explosion of, okay? So what's migraine disease triggers? So a migraine trigger is that which leads to the initiation of a migraine attack in those with or predisposed to migraine disease. So it's important to understand that a trigger doesn't cause the migraine. The trigger is making you more susceptible to the migraine attack in someone who has migraine disease. In primary literature, there have been studies that depict commonly reported triggers. We know triggers can be anything. It can be weather, it can be temperature, it can be food, light, sound, smell. But the most commonly reported triggers in literature is food and drink. And we see all the different types here: chocolate, cheese, nut. You guys know all about this: chocolate, cheese, nuts, citrus fruits, processed meats, monosodium glutamate, which is salt metabolite, aspartame, which is found in diet sugary drinks, coffee, fatty foods, alcohol. We all know it. But then there's this conundrum that I can't get a grasp of. So my patients tell me that chocolate is their trigger, but sometimes what happens is, okay, they eat chocolate, then they get a migraine attack, and then they might crave chocolate, because sometimes people have cravings during migraine attacks. So we have this conundrum of what came first, the chicken or the egg? Did I crave chocolate and then eat the chocolate and then have the migraine attack? Or did my migraine attack start, cause me to crave the chocolate that I ate, that then worsened after I ate the chocolate? It's just this dilemma. And really it's bothering all of us headache specialists, and there's research now about it. What I wanted to point out is, this highlights the migraine disease phases, okay? So there are 5 phases of migraine disease. There's the premonitory phase, the aura phase, the pain phase, the postdrome, and the interictal. Interictal is a fancy term that just says you're in between a migraine attack. And that just means you're not having a migraine at all. It's just the regular state of being, okay? The premonitory state we'll talk about. What you see here, the schematic, you're seeing that there are different brain structures that are activated during the different phases of the migraine that are responsible for what's happening. So with the aura phase that I discussed before, you see could have visual changes, speech difficulties, confusion, numbness, because of this cortical spreading depression that's happening. In this picture, they highlight the back of the brain, because the classic feature of an aura and cortical spreading depression is this movement of excitability that moves from the back to the front. Then you have the migraine pain phase, which is what we see. We have this unilateral, most likely, but it could be both sides of the head, throbbing sensation of the head that can have nausea, vomiting, light sensitivity, sound sensitivity, all of the above, that causes you to lay down and have disability, and it's horrible. So you have the majority of brain structures involved in this, and you can see, if you look at the details of this brain, you can see the same picture that I showed you before, and you can see how it's connecting to different structures that I highlighted. And you see that trigeminal ganglion right there. And then we have the postdrome phase, which is what happens after the pain phase. And I really look at this as the recovery period. And it doesn't mean the symptoms are gone. You still don't feel like yourself. You're still recovering. And these inflammatory substances are still hanging around and doing their thing and wreaking havoc. And really, a lot of the focus of the clinical trials in terms of finding medications is to help all of these phases, right? So we're going to go into the premonitory phase. So with the premonitory phase, it's the initial migraine phase. And what people don't realize is that it can occur hours to days prior to the pain phase, okay? And the symptoms that can happen, you can have sensory sensitivity. So you could be sensitive to light, smell, sound. You can have changes in mood, just not feel yourself, irritable or fatigued, depressed. And then you can have food cravings. Ding, ding, ding. So you might crave the chocolate that you think is your trigger that you're eating in response to the initial migraine migraine premonitory phase. What structures are involved with this? The hypothalamus, which I pointed out to you, limbic areas. The limbic areas are really responsible for emotion and reward. And then the cortex. And this study below here that says Carson, Goldsby et al. And company did a research study to look at this conundrum of what came first, the cravings or the trigger, migraine initiation attack. And they wanted to look at that link between trigger and premonitory symptoms and to see if something exists. And what they did was they took participants and they triggered a migraine, and they used a trigger of nitric oxide because that can trigger a migraine. And they gave them that and they monitored what happened. And they saw that the premonitory phase started, the migraine attack, and patients had triggers, had cravings to things that they thought were triggers. So again, it sheds light on falsely attributing triggers to migraine attacks. this is a small study. It's the beginning. There needs to be more studies involved in order to look at this in depth, in order to support these findings. But really, it's a light bulb is going off here, and making all of us pay attention to the fact that there are 5 phases, and your migraine may be starting hours to days before. So be careful. And also, I'm of the camp that you don't need to torture yourself in thinking, oh, I can't have, this person is not eating chocolate, I'm not going to eat chocolate too because it's a trigger for me. You really want to individualize this and really think about it. All right, so I wanted to close out this session and talk about special diets and evidence. I know everybody wants to know about this, but I really wanted to tag on the evidence part. And you'll find that really there's a lot more work that needs to be done in this area, and it's an area of growing interest. So I'll do my best to present to you that evidence. I hope it may not be satisfying in terms of what you should do, but it's food for thought. Okay, so first up is the gluten-free diet. So the gluten-free diet came to be known because people thought of its connection with migraine disease and celiac disease. So there was this 2015 study in which 200 participants were separated, 100 with celiac disease and 100 without celiac disease. And they put them on a gluten-free diet, and they wanted to see what happened, right? So in the celiac disease group at baseline, they found that those individuals were 2.5 times more, they had 2.5 times more migraine attacks as compared to the group without celiac disease. And then when they put in their intervention of the gluten-free diet, 25% experienced cessation of migraine attacks, and 38% experienced frequency reduction. So that's some evidence that shows that, perhaps gluten-free diet can be impactful in individuals with migraine, because we can see here it made an impact there. And then there was a 2018 study that showed that of individuals with celiac disease, adults and pediatric populations, 22% to 18% of those individuals had migraine. So with these studies, a lot of researchers and doctors think that perhaps if someone has migraine, they should be screened for celiac disease, because maybe being on a gluten-free diet could help their symptoms further and help overall health that may be occurring that you may not think to talk to your migraine doctor about, right? So you should talk to your migraine doctor about any GI issues that you're having, if you've, based on my talk today, because there's a connection. There may be a connection that's specific to you. So again, more research for the definitive cause-effect relationship. Next, we have the low-fat diet, and there were 5 studies that evaluated low-fat intake, and they did show that there was a reduction in headache frequency correlated to a low-fat diet. More specifically, there are different types of fats. So there's omega-3 fatty acids and omega-6 fatty acids. I think of omega-3 as the good fats and omega-6 as the bad fats. And in certain studies, they showed that a high omega-3 and a low omega-6 had a higher headache improvement than just being on a low omega-3 diet alone. And then another study showed that with omega-3 fatty acid diet, there was lowered expression of the inflammatory substances that are prevalent in migraine disease cascade, which is TNF-alpha. I purposefully put here headache and not migraine in certain sentences, if you'll notice that, because a lot of these studies don't necessarily test people with migraine. They're testing individuals who have headache in general. So this is kind of like a starting point here. But there's, because there are similar pathways involved with a headache and migraine, which are 2 separate things, it's important to look into these studies for that. So what we learn here, omega-3 and omega-6 are precursors to certain inflammatory regulators. We see that they have a role in the inflammatory response. and then and in prostaglandin synthesis. And what that is basically, that's the body's endogenous kind of pain reliever system. And also platelets help with inflammation and wound healing. And what platelets are, they're basically little cells within the blood that go to different areas that are damaged and they coat them. So if you were to cut, if you have a paper clip and then you see the blood and then it starts to kind of heal, those are the platelets that are doing their job. They ran to the area to help that. So we see omega-3 and omega-6 important in that inflammatory response. Okay, the low glycemic diet. So this means a carbohydrate restriction to 40 to 60 grams. And with this diet, we see that carbohydrates are ingested in the form of legumes, vegetables, fruits, and high fiber cereals. And we've seen this low glycemic diet really helpful in other disorders, such as epilepsy, weight management, diabetes, and hyperlipidemia. Now, there was a 2018 study that showed a number of, there were 350 people in them. And with individuals following this low glycemic diet, there was a significant reduction in attacks after 1 month. And then at 3 months, those attacks were reduced further. And there was a legume, I'm calling it the legume diet study, but really it was a study where individuals had their primary source of carbs from legumes. And it revealed that with this diet, those individuals had lower levels of inflammatory mediator receptors, which can be in favor of migraine. Now, I don't have slides on the ketogenic diet, but with this diet here, the premise is that you're pushing your body into ketosis because you're lowering your carbohydrate source and you're increasing other sources. So, and that's why it's helpful with epilepsy. We know the ketogenic diet is helpful with epilepsy. There's more research that needs to be done on this topic, but that's where the basis of this comes from. Then we have the low sodium diet, DASH diet. So this implies that high blood pressure can lead to headache. We know that this is true. We've seen that, and there are many different mechanisms that occur with this. Where this came to play was monosodium glutamate intake. There are some studies showing that individuals who ate out of certain restaurants, what were cited were Chinese food restaurants, where if they were they consumed high levels of MSG, that would induce a headache, and that may induce a headache that had migrainous features. The DASH study diet looked into this further and to see if there was improvement in headache with low sodium intake. So what they did was they had controls who ate whatever, and then they had DASH diet patients who had low sodium intake, and they looked at low sodium versus high sodium in those participants. So they saw that there was no difference in controls that ate whatever they wanted versus people who ingested the DASH diet. However, when they looked within the DASH diet, low sodium versus high sodium intake, they saw that the headache risk was lower for individuals who had low sodium intake versus high sodium intake. I mean, what do I take from this data? Really, it's more research is needed because it's conflicting. So again, we need more research, take it with a grain of salt, but something to consider. Weight loss and migraine disease. So within the field of obesity and headache, in 2003, Schur and company did a research study, and they showed that individuals with a BMI of greater than 30 had a 5-fold risk of developing chronic daily headache. Those with a BMI of 25 to 29 were 3 times more likely to develop chronic daily headache. Again, ding, 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 I'm not using migraine disease here. I'm using chronic daily headache, and that's what they tested. So what they found was patients had more headaches with obesity as compared to normal weight. And then in other research studies, we find that abdominal obesity and general obesity are independent risk factors for headache. So abdominal obesity by itself can be a risk factor for headache, and general obesity by itself can be a risk factor for headache. So naturally, when we see a study like that, we think to ourselves, oh, so what happens if we lose weight? So there are some studies that looked into the effects of certain weight loss strategies. So they looked at non-surgical versus surgical. And we see here the diet approach, low calorie and ketogenic diet. It showed that one study showed that they had the potential to decrease migraine occurrence. One study showed that there was no benefit on migraine on a low calorie diet. Another study looked at comparing bariatric surgery to a low calorie diet to an exercise with an exercise program. And it showed that the individuals who had bariatric surgery had a better headache improvement. There are two studies that show bariatric surgery being correlated to decreased migraine severity, frequency, and disability in women. I'm not showing you this study to tell you to go have bariatric surgery. I'm showing you that the main idea here is the weight loss factor and the obesity factor that may contribute to migraine disease. And they kind of just wanted to see, hey, what happens here versus another. I think bariatric surgery can be a path taken for certain individuals, but this is just a comparative measure that they did in the studies. So what's the link between obesity and migraine disease? The link is inflammation. Inflammatory markers, CGRP, are found elevated both in individuals with high BMI and migraine disease. So we see here the link is inflammation. And also there are some studies done that showed adipose tissue, which are fat cells, contain inflammatory substances. So more research is needed once again. So to summarize, nerve cell and migraine disease pathophysiology is a gateway to understanding how to better utilize nutrition. The brain and gut connection involved in the relationship between gut and microbiota, inflammation and nerve response is really important. There are 5 phases of migraine disease, and triggers may be linked to the premonitory phase, so be careful. And then evidence for the use of special diets is limiting, but promising. Really, it's an individualized approach. Talk to your doctors, really have that relationship. Don't hold back on your symptoms. Just explain things, because little details that you think may be unimportant might be important to us. And thank you so much. Thank you to Miles for Migraine for having me today. I hope this was helpful. And this is where you can find me talking about different topics on headache medicine, education, and what have you.
Thank you so much. That was amazing.
I'm going to stop sharing things. There we go.
Okay, that was amazing. And we have a few questions for you, so I'll jump right into them. How does anxiety and depression affect migraine in the gut?
Right. So that's a good question. With anxiety and depression, there are different substances that are secreted, right? So different neurotransmitters. And the powerhouse neurotransmitter is serotonin. And we see that there are high levels of serotonin in individuals with depression, in individuals with migraine. This is why antidepressants, SSRIs, serotonin reuptake inhibitors, are blocking the effect of serotonin. So we see that serotonin in the brain can, within the migraine pathophysiology, that increased level of serotonin can increase inflammation. And in the gut itself, when the gut is revved up and creating inflammatory molecules, they're creating byproducts of serotonin, which is tryptophan, which are the tryptophan precursors. So you can see how there's kind of a full circle of the 3 of them being involved. It's a lot more complicated than that, but that's kind of where we start in terms of looking into that.
Gotcha. Thank you so much. Is there an association between non-celiac gluten intolerance and migraine as well?
Yes. So I didn't include this in my slides, but there were several studies looking into gluten insensitivity versus celiac disease and its connection to migraine. To make a long story short, they were inconclusive. They were mixed results. So there were some studies showing individuals who undertook a gluten-free diet had improvement of their attacks. And there were other studies that showed that it didn't do anything. And that's where the studies that honed into celiac disease were more kind of promising, because they wanted to kind of make that they wanted to establish if the person had celiac disease, which is very different from gluten hypersensitivity, and make that connection and say, it's the celiac disease, it's this autoimmune process that's involved.
Okay. And I have one more question here. Why does migraine treatment not factor in the gut-brain connection for those of us with both migraine and gut disease?
That's a good question. I can't answer on behalf of the researchers, but what I would say is looking at the pathophysiology of migraine and what's happening with the hyperactivity of the brain itself. I think there's focus on what's intrinsically happening with the brain and those connections that are there and what's being released by the nerve endings. So there's this focus on what's happening in the cranial vault and less of a focus of what's happening in the gut. I would understand and think that future research will occur where there may be connections made between the two so that there can be treatments for that. However, I will say that with the research that's being done, we've come to know that there are commonalities between the two. So it's kind of like a kill two birds with one stone situation, like CGRP, for example. CGRP has receptors everywhere in the bone, the gut, the heart, the muscles. It's responsible for a lot of things. And we see that there is a positive response with targeting CGRP. I don't think there are any studies, or I don't know, I'm not a gastroenterologist, so I can't talk about CGRP in the gut itself, but it would be interesting for me to see if there are any studies targeting CGRP for different gastrointestinal disorders. I don't know, I'm just talking out of my head, but I feel like that maybe there's something there.
Right.
But that's a great question.
Yeah.
We'll tell the researchers.
Yeah, as you said, more studies are needed, right?
Exactly.
And just to end this with a comment from someone else, she said that she wishes more physicians understood the subject of triggers instead of just saying stay away from chocolate and wine in the prodrome phase. And it seems common to people with migraine, just as many phantom smells seem to be shared upon us.
Yes, you said phantom smells?
Yes.
Yes, it's funny that you say that. So I did this research study looking into asking questions on social media about if people have smells, sounds, tastes that they feel with their migraines. And it's sad because I wrote the paper, but I didn't submit it to a journal, but I will. But I believe you, that is a thing. It's not a part of an aura. I really think that it should be considered an aura because it exists. And really, you need to tell your doctors about this, because I can't tell you how many people chatted about this on the internet, but don't tell me in the office. Tell me in the office, please.
Yeah, because we feel like we're crazy, right?
No, you're not.
Well, thank you so much. You were amazing. It was great to hear what you had to say and how you expressed it to us. It was a great presentation. So thank you very much for your.
Thank you so much. If you guys have any other questions, you can find me on Twitter and Instagram as Simplified, like sin. If you can DM me. Okay.
Okay, great. Thank you so much.
No problem.
I think Susie has a question. Susie,
Oh,
it's your square. Do you raise your hand?
Susie?
Susie's friend.
Okay.
Hello, my name's
Hi.
Chris.
Oh, hi.
I have migraine. I have a question.
Yes, absolutely.
I noticed that whenever I have a migraine, I'll be really tired, but also I notice I'll sometimes get really hot or feel really sweaty. And usually after a migraine, I'll get really hungry. Like rarely whenever I have a migraine, do like even if I eat before I have a migraine, usually after I always feel hungry.
Yes, and this, I'm glad you spoke up and said that, because this is an example of the phases of migraine. If you remember the picture that I showed you, you can see that there are different brain structures that are involved. And in the premonitory phase, you do see certain symptoms that people have, like cravings and being hungry, despite the fact that you ate or not. Because honestly, the brain is the boss. Right? Well, I'm a neurologist, so I think the brain's the boss. But the brain really is important for those feelings. And there are substances that are released by the gut that tell you that you're full. But this over here, this pathophysiology and this hyperexcitability that's happening in the brain is surpassing that. And also to speak upon you feeling hot and you feeling tired, that's again, those connections that you're seeing with substances being released that are really touching upon different areas of the brain to make you feel that way. So it all makes sense. I'm glad you said that in front of everyone. It all makes sense.
Yeah, that's great. Thank you so much for that question. Okay, wonderful. Well, let me